It can be more enjoyable when things in life are rather clear-cut. But if you're going to live with cats, you have to deal with things that are uncertain, weird, and sometimes annoying. And one such case is when you think your cat may be hyperthyroid, you get the blood test and it comes back borderline. Does the cat have hyperthyroidism? Should you treat? Should you not? It can be a tough question. But anything over the middle of normal up to just slightly high is called the gray zone. And in that range, a cat might be hyperthyroid, might not. Now, the first thing you should do in a case like that is ask your vet if they palpated the thyroid, which is a technique for trying to feel the thyroid. Feline hyperthyroidism is caused by an almost always benign tumor. And a normal thyroid can't be felt, period. But if there is a tumor, then this technique may allow a vet to feel the tumor. However, the vets who are, say, average to pretty good at it can feel an existing tumor about 50% of the time, and that comes from one of our vets. The vets who are really good at it can feel an existing tumor about 90% of the time, which also is information from a vet. So, feeling a tumor confirms the hyperthyroidism. Not feeling a tumor doesn't confirm anything one way or another. And if it's an early case, there's a good chance the tumor maybe can't be felt. So the next thing you do is consider symptoms. If the cat has been losing weight, still eating well, or even eating more, then that's your key symptom. And that would indicate that the cat is hyperthyroid. Maybe you need to treat. If there are no significant symptoms, then you probably would be better off waiting 1 to 3 months to retest, and there's a good chance that's what your vet is going to suggest. You don't have to hurry. This is not an oh my gosh, got to do something situation. I often say cats are here to teach us patience, and this is one of those times. Another thing you need to consider is that it is now documented that cats can have a slightly high T4 and free T4, and those are the two main thyroid hormones that are used for diagnosing hyperthyroidism, mostly the free T4. But these numbers may be slightly up, but no tumor. That was confirmed by Dr. Mark Peterson a few years ago using scintigraphy, which is the clearest way to get a look at any existing tumors. And it turned out sometimes they weren't there. Now, what causes these spikes that may be very long-term in duration, it hasn't really been studied at all. We can make a few guesses from studies that were done when looking for causes of feline hyperthyroidism, but it's really kind of a tricky guess. Food may be involved in some cases, but that's not clear. But if there is no tumor, one thing is certain, and that's you do not want to do the I-131 radioactive iodine. If there's no tumor, then you end up wiping out the healthy thyroid, the same as happens in humans. So you do have to proceed with more caution. And from what we've seen in the online groups, I have a suspicion that the borderline cases where there is no tumor actually react more strongly to the methimazole. So you may want to consider, if you do start medication, you may want to start not just low, but extra low. Some cats out there are actually on 6 to 5 milligrams of methimazole twice a day, which is only a quarter of the most common starting dose. And there have been a few cats that need the medication, but all they need is 0.625 milligrams once a day. You have to keep in mind cats are weird. So if you get that borderline diagnosis, check to see if the vet palpated the tumor. Consider whether or not you want to wait if there are no significant symptoms. And the most significant usually early on is weight loss. Blood pressure and heart rate are sometimes up early in hyperthyroidism, but they may also just be up from the stress of the vet visit, so they aren't really good guides at this point. They are things that should be checked, but not necessarily what you want to depend on for making your decision. So take a look at the results. Remember that you have to treat the cat, not just the numbers. And sometimes that takes more patience than we think we have. So good luck with that. I do suggest joining the Facebook Hyperthyroid Cats group. You'll find a link in the description below this video. And you'll also find some information if perhaps you feel an overwhelming urge to make a donation. Not asking for it, but, well, the cats would appreciate it. Might be able to buy them some of the more expensive food sometimes, which they might or might not eat. See you later.